I'm DeLisa Fairweather. I'm Director of Translational Research at Mayo Clinic in Jacksonville, Florida, and I've just given a presentation at the International Academy of Cardiology, the annual scientific sessions in 2018 that were held in Boston. And my talk at this presentation was about exosomes. So exosomes are small bilipid layers that are excreted from all cells in the body, and that includes cells from the myocardium, cardiomyocytes and fibroblasts and endothelial cells, as well as immune cells. And we became recently interested in exosomes as a possible therapy. They've been used and investigated quite a bit as a therapy. It's important to note that they aren't always good, though. They also can contain viral particles, and so are possibly able to increase inflammation as well as prevent it. So we recently became interested in exosomes, and we have a long history of looking at sex differences in inflammation of the heart called myocarditis. Myocarditis is a leading cause of sudden death in children and in young adults under age 50, and it can lead to a dilated heart called dilated cardiomyopathy. And we have noted that both clinically and in an animal model that myocarditis is about 3 times higher in men than in women. And we see that that's sort of the same ratio for dilated cardiomyopathy. And we've been studying sex differences in disease. And really it's men that progress from myocarditis to dilated cardiomyopathy, and women are quite protected. And testosterone does increase inflammation in the heart, which we've shown in our animal model, and estrogen protects against it. And so the traditional exosome therapy that people are using is to collect exosomes from blood products, from blood cells, and doing that in healthy men and women of all ages. And that product, when it's purified, called purified exosome product or PEP, and that's what's most traditionally used, either injected intramuscularly or with an IV treatment in animals to really show benefit. It's shown benefit in myocardial infarct, for example. And so knowing that women are protected strongly by estrogen from heart failure and from myocarditis, and that disease is promoted by testosterone, we thought it would be a good idea to look at premenopausal exosome products. So in that case, we looked just at women. They had not gone through menopause yet, and we collected purified products, and we call that PM PEP or premenopausal PEP. And so we took the human product, both the PEP and PM PEP, and we injected it into mice, male mice, to see if it might be able to protect against myocarditis. We gave it intraperitoneally, so this is because that's how we induced the model. And we gave it during the innate immune response. We wanted to test initially to see if this, we know that anything that changes the innate immune response alters disease, and so we wanted to do that to see if there could be an effect giving it IP. So we injected both of those in males and looked at myocarditis during the acute stage in the animal model. And what we found was that the regular PEP did not have any significant alteration of inflammation, but we found a significant decrease in PM PEP. And when we looked at the actual immune response in the heart, we found that it was globally regulating and down-regulating all of the inflammation and all of the markers that we looked at. And one of the things that was most interesting to us was we found a change in complement. So complement is very important in the innate immune response. It's our natural adjuvant, activates innate immune response, and we found that complement components were decreased with PM-PEP, and there was an increase in complement receptor 1. So complement receptor 1 regulates complement, really inhibits it, and allows us to control inflammation after we initiate it. And we had found previously that that was one of the most important factors that was increasing myocarditis and also was critical both in patients and in the animal model in promoting the change from myocarditis to dilated cardiomyopathy. And so when we saw this, we really have been investigating the complement receptor, how it works, so what its mechanism is. And what we have found is that after you have the viral infection, you need to have a very rapid immune response to protect against the virus. The virus, we use the virus to induce this model, and if you don't protect against it, it's a lytic virus. It's going to destroy your heart and other tissues. And so you mount a strong immune response, which is activated by complement. And what we found is that female mice regulate this. They upregulate complement receptor 1, but male mice don't regulate the response. And so they have much higher inflammation. And so it looks like the premenopausal PEP is working by enhancing this response in males and behaving much more like a female response. So it's regulating the inflammation. So at the moment, we are now looking, because remember we gave this during the innate immune response, which is not a clinically relevant time point. We don't know when people are infected with the virus. And so what we're investigating at the moment is, will this also work if we give it at a clinically relevant time, like during myocarditis or after myocarditis occurs, before dilated cardiomyopathy? Could we potentially prevent progression to DCM? So that is what I presented at the meeting, and these are ongoing studies, and so hopefully we'll find a new possible treatment for this patient population.
Thank you very much. Perfect.